Welcome back to Health Bulletin. Today, we have a very important health alert coming all the way from the mesmerizing Maldives, where there is re-emergence of a dangerous disease, pertussis. It appears that pertussis, also known as whooping cough, is making an unexpected comeback in this tropical paradise. The resurgence of pertussis has raised many questions. How did this happen? And what can be done to protect high-risk group? Pertussis, which was once under control in the Maldives, has resurfaced with 3 confirmed cases identified in Gar Vilingili. The Health Protection Agency, HPA, has announced that contact tracing is currently underway in collaboration with Indira Gandhi Memorial Hospital and Garfu Alifu Atoll Hospital. Pertussis is an extremely contagious respiratory infection caused by the bacterium Bordetella pertussis. It spreads through airborne respiratory droplets and can be severe, especially for infants, young children, and those with weakened immune systems. Health officials advise that antibiotic prophylaxis should be administered to infants and pregnant women who had contact with the infected individuals. To combat the spread of the disease, Garfu Alifu Atoll Hospital has established a dedicated task force, working closely with relevant entities on the island. Pertussis is transmitted through the respiratory tract and initially presents symptoms similar to those of a common cold. After approximately 1 week, a prolonged and severe cough may develop, particularly in children, who may also experience additional symptoms. However, individuals who have been fully vaccinated may not exhibit severe symptoms. Given that children are particularly vulnerable to this disease, authorities strongly advise immediate vaccination for all unvaccinated children under the age of 7. The HPA urges individuals with persistent coughs or other cough-related symptoms, especially those with chronic diseases, children and pregnant women, to seek immediate medical advice from a healthcare provider. Early diagnosis is crucial, and vaccination is the best preventive measure. Timely antibiotic treatment can also help reduce symptoms and prevent further transmission. Thank you for watching. Don't forget to hit that like button, share this vital information, and subscribe for more health alerts from around the globe.